I am a nurse practitioner in Medina, Ohio, and I am here for your entertainment, for your questions, just for general anything that you guys want to talk about. So let's start out with the free consultation while we're waiting for some people to get on. Basically, I've been on these meds for 4.5 years. I have been prescribing them for 4.5 years. So I do not give medical advice. I am giving you my experience. I'm giving you my experience with my patients. I'm giving you my experience personally. And I've prescribed to thousands of patients. I have lived with a lot of people doing these. So I have a lot of experience to give you. And what I am doing is I'm actually starting a new program, realglp.life. And what we're doing is just giving you everything that I have learned and everything that I have just the experience of everything. So there's a lot of experience shoved in this body, people. So I am down about 104, and this is what I used to be. All right. So I never want to go back to that girl. I love her dearly, but you know what? I don't want to go back there. That is for darn sure. So I have a lot of tricks and just a lot of things that I have learned over the years, and I just give that experience to you, to be honest. And, you know, it is just something I do. So if you're on compound S, been on a stall for months, how do you know when to switch to T? So first of all, when you hit that stall, so what you need to do is you need to look at your BMI. If you're in that BMI of 24.9 to 29, then that is a lot of times when people hit the stall, because that is the difficult time. That is when things do tend to get hard. So when you are there, you have to. So when you hit that stall, what you have to do is you look at your BMI. Then if you're in that 30 plus BMI, a lot of times it's because we have a good L and our body is just like, hold up a second, let me get situated here. So you need to look at your protein. Are you getting that 100 to 120 grams a day? Then if you're getting your protein, are you getting your hydration? Because what we need to do is we need to make sure that you're getting both of those things. Then you need to look at your calories. Now, you have to make sure that your calories are always above 1,200, because if they're not, then you need to make sure they are. Women should be 1,300 to 1,400 calories because it's extremely important. So what you need to make sure is your 1,300 to 1,400 calories. Guys, 1,600 to 1,800 calories. Now, if you're doing those things on your business, then what I need you to do is DM me, because what I can do is help you figure out why are you hitting that stall. Before you switch to T, there are some things you need to do. Yes, I have been on both twice, and I can help you figure out, because the cost is so expensive and you don't want to switch right away because of that cost, because it's about $100 to $200 difference. So in my clinic, it is. And I can help you figure out, okay, what is going on? Why, when should I switch and all of that stuff. But let's try some things before you do the switch. So give me a call or text me or DM me, none of your business, and then I can help you make that decision. So because there's some things you need to look at before you make that decision. And I'm down 14 in 2.5 weeks, but I'm getting nauseous because it's a lot that you've dropped in 2.5 weeks. So you're getting nauseous because your body is saying, whoa, hold up. So you need to slow down. And what I recommend is making sure, first of all, get some Zofran or some ginger or something like that. Slow down. Don't increase your dose. Make sure you're getting your calories. And what I mean by that is at 1,300 to 1,400, make sure you're getting your protein. And what you want to do is hydration. So you want to make sure you're getting your your electrolytes. So what I would suggest is like the Propel, Ultima, or 10X or something like that. But you need to get, slow down, because what your body is telling you is you're doing it too quickly. And that's a thing. So you want to make sure that you are getting those calories, because if you're not getting those calories, you're losing too quickly. So women are 13 to 1400 a week typically. And what you want to do is about 64 to 80 ounces a day, but about two of the packets of electrolytes a day also is very, very important, because you don't want to drop too quickly. And that's why you're getting nauseous, is because your body's telling you you're going too fast. So you just really, really, really want to slow down a little bit, and you might hit a stall, because if you go too fast, your body is going to go to a screeching halt, and that's normal also. So you really just want to make sure that okay, so you said, Strap, that you're not getting your calories. It's been really hard some days to hit that. And that's normal, especially when you're first starting out, if you're a super sensitive person to these medications, because your body is telling you that okay, first of all, if you're super sensitive to the meds and you're not able to eat, it is your body telling you that, you're nauseous, because your body is telling you it's too much. So you have to drink the calories, drink the protein, make sure you're getting your hydration. There are some clear proteins out there, so you can kind of trick your body that you're getting those calories and you're getting that protein, trick it. So it's because, you can't do the milky ones, because your body doesn't want it. And if you drink that milk, it makes you more nauseous. So then get the water ones. And I don't have them in here. So like the Ready, or get there's one that's called Ready Seek, Seeq. And I did put that one in my shop. So you can get the Seek, Seeq. It's a clear one as well. Now, if you do, that one is a whey. So if you do it and it bloats you, then you can't do that one. But there's also Perfect Amino. That is in my shop as well. And that one is it's pills. So it helps you also. So that one is a really good one as well. So if you find that just different things like that, or if you find things that you can help just get those calories, that is going to help prevent you from getting nauseous. But the protein shakes don't make me feel good at all. Yeah, because that milky ones, they don't work. So what you need to do is find a clear one, or broth. You can do like any of the broths. Those will help you also. So you can do any of those broths. You can do, you can get like even the chicken broths or anything like that. So any of those things are really, really good for you. Any of the clear proteins, waters, any of the clear protein waters, they have flavors. So any of that stuff will work. And try ginger. Ginger is a really good thing also. So if your stomach is upset, we used to go to like the Sprites or the ginger ales or things. I can't do bubbles anymore. They taste absolutely disgusting. So you want to try and find things like that. And if anybody else could also put in the comments some of the clear proteins or anything like that you found. Oka is another good one. It's OAKA. That would be fantastic. Why not just restrict calories without GLP? Won't you lose weight? No. So this is a great question, and we're not going to attack this person for asking this question, because this is a great question. So what we're going to do is we're going to be nice today. So what a lot of us do, I'm 52. And what happens when you hit about 35, women especially, is our bodies go through changes, and we start hitting the premenopausal and the hormone changes. And what happens is we have a lot of insulin resistance, or maybe you have PCOS, or you have just a lot of thyroid issues can do this. Autoimmune disease can cause this. But what happens is we just have this big hormonal switch in our bodies. And I'm military, so I was in the military. So I know how to eat. I know how to exercise. I know discipline. I know how to do the calorie restriction. I've done all of this all my life, on and off. So I was a huge yo-yoer. So I've done this, but this was my top. well, actually, this is 20 pounds away from my top. This was when I was 240 and my top weight was 260. So I've done this up and down, up and down, up and down my whole life. So my comfortable weight was always 180, and now I'm down to like 157. When I came out of the military, I was 155. My lowest was like 130. When I went into the military, I was 133. So, having this, just the ability to just have the L, just by the calorie restriction, I've done that, but I was never really quite successful. And I did have the PC, it's actually PCOD now, but I did have that because but when I had the cyst on my ovaries, they didn't actually call it that back when I was in my 20s, early 20s. I didn't know that that's what it was, but we actually had to drain two actually off of my ovaries, but I didn't know what it was. So when you have that hormonal imbalance, it's very difficult to correct. You can't correct it. And especially when you're 35. When I was 35, they didn't do hormone replacement for me when I was 35, being 52 now. Because when I was 35, the answer was, just deal with it. There's nothing we can do for you. Or, we'll put in an IUD, or we'll do an ablation for you because your periods are all out of whack. Or, they just didn't do much for you at that point. So when, it's just kind of like, yeah, do calorie deficit, do these things, but it didn't do anything, yes, you could have that, but it didn't do anything for you. You struggled, you were starving to death. And it was just this battle that you had to fight. But mine was this noise, this constant noise, constant obsession with food, just worrying about it, just always thought process about it. So when you do the GLP, what actually happens is it really fixes, I'm not hungry, I'm not craving anymore. It slows down your digestion so you can't get as much in your belly. And then it corrects the insulin resistance. So what happens is when you correct that insulin resistance, it actually balances out the hormones a little bit better. So then it actually corrects and it gets rid of the inflammation. It actually is going to help you. It helps your body with the cardiac issues. It helps the liver, the kidneys. So it's actually doing this whole overall improvement in your body. And this is actually research based. This is not just Angela spewing information. So this is really improvement of so much in your body. So good morning, Mule and Goat on my other television. So there's so much improvement of what it does for you, not just help you with L. So does that make sense? So it really, really is helping you overall, the whole body. So that's when somebody says, you can just go in calorie deficit and you can have the loss. That is not completely true, because when you just go into calorie deficit, you are going to have, yes, the L, but you still have that food noise. You still have that hunger. You still have that craving. You still have that, oh my gosh, I am starving to death. I really, really need a cheeseburger. And you will have that failure. But now I've been doing this for 4.5 years. I don't have the failure. I don't have that over obsession of, oh my God, what am I going to have in 2 hours to eat? Food is not a thought anymore. And that's what I really, really, really love about GLPs, because it has completely changed how I look at food. It has really changed my overall look of what food is. And that is what is fantastic about everything when it comes to everything about food. And this is not just me. This is with so many people. And that's what's fantastic about it. So yes, I'm so happy you asked that question, because it really, really is important for people to understand that aren't on a GLP. So if everybody could please share my live, I would really, really appreciate it. And if everybody could please follow me, I would really appreciate that as well. My name is Angela. I am a nurse practitioner. I have a clinic in Medina, Ohio. I am able to service all 50 states, but I am not here for you to sell to you. I am here to teach and educate. And that is really honestly what I am here for, is to teach and educate. So Mule and Goat is actually on another area, which I can't say, but they actually said you need to make sure that you're adding in fitness as well, which is a really, really important thing. And what I highly recommend is resistance training. And they actually can help you if you're not able to get to the actual gym. They have an online program. So if you go to TikTok and just go up to the little magnifying glass and search them, Mule and Goat, which is hilarious. They're on everything. I love it. Just like me. But just search Mule and Goat, which I love their name. You can actually find them, and they can help you with any kind of fitness needs that you have. All right. The Brooklyn PUJA. I don't know how you say that. Do GLPs help with cravings? Yes, they do. So here's a really, really good question. I heard it helps. So I'm going to say this. I'm trying to think of the proper way to say Mary Jane. We're going to go with Mary Jane. This is a great question, because Veronica, is that a good way to say that? Mary Jane? Everybody know what I'm saying when I say Mary Jane? Can I say that on here? The forbidden lettuce. We'll go with that. Okay. So my mother loves the forbidden lettuce, and she's on the GLP. And I've asked her this question multiple times because she loves the forbidden lettuce. So does she get cravings? No. And she actually has done very well with her loss. She's actually at 150 pounds. So what I would suggest is there's two different types of forbidden lettuce. So what you have to do is make sure, because I actually have another lady that comes into the clinic, and she does have an issue with cravings. Now, the GLP, her L is not as good as my mom's L, because her type of forbidden lettuce is one that does cause cravings. So you need to make sure that your forbidden lettuce is the one that doesn't cause the cravings. And you know what? I need to do a video on this. I wonder if it'll go good or not. Okay. So there's two types of forbidden lettuce. One causes cravings and one does not. So when you're choosing your lettuce, you need to make sure it's the one without cravings. And what you do is, then you'll be okay and you'll have good loss. So then you also need to, when you are having menopause, premenopause could actually start at like 35. And that's what I did. I started at 35. So when you are having that perimenopause, what we do is we can do your labs in all 35 states. Okay. Or 35 states. There's 50 states. Dear God, where am I at? Okay. So all 50 states, we can do labs. And then what I do is I can't prescribe hormones in all 50 states. I can do about 8 states, but we can help you figure out what you need. And then I can help you figure out where to go and how to get that done properly. So there are multiple options available. I only do bioidentical, and I highly recommend that you only do bioidentical. So then I can guide you in the proper ways of where to go. So I can give you that information. So when you are wanting to do that, because honestly, women, you should start looking at it when you start noticing mental changes, you start noticing physical changes down in your nether regions, or you just notice that your bedroom interest starts changing, or you just are depressed, you have anxiety, and you never did before. And now all of these things are starting to happen. That's when you need to really start getting stuff done, because that's really, really important. Mule and Goat, can you share on that where you're at? And because I don't know if you can or not, but I was wondering if it's possible for you to share, because that would be really, really cool if you could do that. That would be awesome. If you could do that, because that would be really cool. All right. So, we could definitely help you. So please reach out to us regarding that, because I would love to help you with that. Everybody, please share this live. That would be wonderful if you could do that. And if you could do that, that would be fantastic. I am the gummy queen. Yes, that is very true, Jose. So somebody asked so does it help with your cravings? Okay, let me get, I got lost for a second here. Okay, let me go back. All right, Brooklyn, your questions are not coming through. Okay, let me see here. Should I take, okay, somebody else's some of these questions, just to let you know, TikTok likes to block questions. So, yes, empty stomach, I don't know where that question went, but let me answer this. It does not matter if you take it on an empty stomach or not. It does not matter. Some people say yes, some people say no. I don't really say yes or no, because it really doesn't matter. Just don't take it and then eat a bad meal, because you will regret that. So eat it, or take it and eat healthy. You should always be eating healthy. So no simple carbs. Okay, if you have it on with simple carbs, you are going to regret that. No simple carbs. Simple carbs are horrible. They are bad, and they will make you feel miserable. So do not do that. Yes, it does. Oh, okay. These are they are finding, so somebody asked if these will help with the forbidden lettuce cravings. Yes, they can. They can help with all sorts of cravings. They have found and are using them for all sorts of cravings. So forbidden lettuce cravings, yes, they can help with those. Okay. They are finding that they are helping with those. Sorry, I started getting nauseous. That's weird. Okay. Are we supposed to exercise on these? I tell people, when you start using them, don't change your habits in the beginning. Okay. You don't have to in the beginning, because you want to see how your body is going to react for the first month or two. Then, yes, you should start an exercise program, because you want to develop a new lifestyle. So yes, you need to start adding in a exercise program. Start out slow, because what we're trying to do is develop a forever lifestyle that you're going to maintain forever. So you're developing a happy lifestyle. You're developing a new you. So you want to find things that you like to do. You want to find things that are you. So when you're doing this, the first thing is you're getting rid of the simple carbs. What I teach is simplicity. So I don't teach micros and macros and all that stuff. What I teach in the very beginning is listen to your brain telling you you're not hungry, you're not craving. Listen to your stomach. Don't eat to full, eat to I feel food in my stomach, and then get your protein, which is 100 to 120 grams a day. Then I also teach no simple carbs, and get 25% of your diet is complex carbs, naturally from the earth. Simple carbs are anything processed by man. Then what you do is, if you're getting your protein, that first month or two, if you're getting your protein goals, naturally you're going to get your calorie count. When you stall, because you're going to stall, when you hit that stall, that's when we introduce calorie counting. Otherwise, at first, I don't teach calorie counting. Then I've never been a macro micro counter because it drives me nuts and I don't like doing it personally. So I don't teach people to do it. Now, if at some point you're like, okay, I want to do that, then I'm going to send you to a nutritionist because I honestly don't know how to do it. Or you can download an app and then the app can teach you how to do it. I don't do it. And then what you do is, if you like to do an elliptical, then you can start doing that. But I'm going to say call Mule and Goat. They can teach you how to do that because Mule and Goat is going to help you how to do it. So they have an inexpensive program and they can teach you how to do things in your home, or they can teach you, they'll figure out what you like to do. So then you just do what you like to do because it's forever. What we want you to do is learn how to do things that you forever want to do. Because if you ever want to go off of these, you need to continue what you learned to do. Then you wean off of these medications and now you know what to do forever. Because if you ever go back to your old ways, then you can. Mule and Goat is actually a certified nutritionist. So now you have your nutritionist and your exercise expert as well in Mule and Goat. So that is a fantastic thing that they can help you with. So that is, what you need to do is figure out. So I can help you in that very beginning. And then as soon as you need to, we can get you to the nutritionist. And if you want to do that in the very beginning, go right ahead. I like simplicity. I keep things extremely simple in the very beginning because if you get overwhelmed, you're going to stop. And I don't want you to stop. I want a forever lifestyle. So that's why I teach simplicity, especially in the very beginning, because I don't want you to get overwhelmed. Because as soon as you're overwhelmed, you give up. And I don't want you to give up. I want you to be understanding and happy and healthy. I am your forever lifestyle coach. I'm going to be there forever. Once you're done and you're like, okay, I got this. I'm good. You always have me and my team there for you. And that is what Real GLP is. We are going to be there forever. So realglp.life is going to be there forever. Yes, don't get your exercise off the web. Use us. That's Mule and Goat. Otherwise, you may be doing too much or too little. We can help you in your progress at your pace and correctly. And that's what's so important when you have a good team. So when you have your nurse practitioner and you have nutritionists and you have exercise people, that is what makes a great team. And that is what we do, is we're going to be there from the very beginning and through the whole process. And that's what's so important. Okay, so the GLP helps the brain, helps the stomach, helps the whole physical body. So yes, it is a psychological as well as physical. It's physical, it's psychological, it's stomach. So it's a whole chemical makeup. I like that. Yeah, it's in everything, Charm School. So yes, you're right. The Ashley-Ann, I haven't dropped in 2 months. Should I go up in dosage? So before anybody goes up in dosage, what I always recommend is your protein up where it needs to be? Is your hydration up where it needs to be? Are you active? And then what I add in is, yes, then you can go up in dose. Especially if it's been 2 months, you may need to go up in dose, but you need to make sure that you have your protein where it needs to be, your hydration where it needs to be. And you can also look at the calories at that point as well, because you need to be there. So protein is 100 to 120 grams a day for women typically. And then your calories is 13 to 1400 calories a day for women, 16 to 1800 a day for guys. And then guys, the protein is 120 to 150. Now, if you want to get technical, there is a scale that you can get that gives you your FAT, your protein, and your BMR. And when you look at your BMR, typically you want 200 to 300 less than that, but not less than 1200. Okay? Never less than 1200. Your heart, your lungs, your brain, your body, just laying flat in a dark room is 1100 calories a day. Okay? So you never want less than 1200 calories. Please don't go less than 1200 calories. Your body needs those calories to function. That is why people get tired, fatigued, headaches. They feel horrible when you go less than 1200. If you're going to go less than 1200 for maybe a short period of time, you have to be under a provider guidance, close provider guidance. You need to be checked weekly, and they need to be monitoring you very, very, very closely. Is it okay to still exercise if you're not meeting calorie goals? No. Because what's going to happen if you're not closely monitored, you can make yourself sick. You can get very tired, fatigued, nauseous. You can, like you were feeling a little bit earlier here, Strap, you were talking about nauseous. You can drop your blood pressure, drop your blood sugar, drop your heart rate. You can actually become very ill, and you can have a lot of issues. That is where somebody like me needs to be monitoring you very, very closely. And we need to talk, and we need to make sure things are going on. Strap, DM me. I can really, really, really help you. And that is where somebody like me comes in. I seriously do free consultations, and I can help you understand and guide you and give you that information that you need. So I can guide you into Mule and Goat if you need. Mule and Goat can guide you into me if they need. I give you that free consultation. My team is here for you. So we offer you that information. So just DM me or go to my bio and get my information, and I can help you understand what it is that you need. And we are here for you to make sure that you're educated and give you the information that you need. Tracy, I would want to fix insulin and not shut off the noise and slow down the digestion. I have reflux. Okay. And a hiatal hernia. So a hiatal hernia, you're fine. Reflux is fine. If you already have slow digestion, I can help you. There are tricks to help you. So first of all, I have really, really bad reflux. Okay. So I take omeprazole in the morning, I take a Protonix in the evening, and I make sure I have Tums around all the time. There are digestive enzymes that you can take. So like something like this, which these are all in my store. So if you stay around to the end, I will, about the last 30 minutes, I will open up and put these things up in here. But you can also go to my store and these things are in there also. So this is ZenWise. Digestive enzymes are a lifesaver. There's another one, I don't have it in here. It's called Nature Made. It's a peppermint, and I had to take one yesterday, but it's peppermint. And what it does is a chewable, and you can just chew it, and it helps digest and break down the food. A lot of times when you have reflux, it's food just sitting in your stomach, and your acid is increasing to try and break that food down. So what you need is a digestive enzyme. So the digestive enzymes help break that food down. So get one of these, and they really do help, okay? So try this. This is really, really important to help you with that. Plus, it has pre and probiotics in it, which is fantastic as well. So what I highly recommend is getting that digestive enzyme to help with your digestion if you have slow digestion already. Because when you have that slow digestion, the food is just sitting in there a little bit longer and it's not moving through your gut. So you need to make sure that you get that food and help it move through your gut. So it's really, really important. So what I recommend is a digestive enzyme. Then you also need to make sure that you are aggressive in the pre-treatment and the prevention of the reflux, okay? Having a hiatal hernia does not just make you not be able to take these, because my husband has that. We just have to be preventative of the reflux. And we can do that with the antacids. So what we would do is we would put you on a Protonics. I would probably jump straight to a medication one or a prescribed one like Protonics, and just make sure you're taking that daily, just to make sure that we're preventing any of that. And that's what we would do. And we would put you on a digestive enzyme. Is B12 good in boosting metabolism? Absolutely, 100%. And what I did is I actually created this. So this is called Recrea Burn. DM me if you are interested in this. So anybody that hits that stall, so not strap, somebody else hit a stall. I don't remember the name, I'm sorry. But what I did is I actually created this. So I took the lipomino C, which is the injection, and I took the, what I did is I actually created this. So I took the lipomino C, which is the injection, and I took the, created this. What this is metabolism booster. It is a FAT burner, and it is a energy booster. So if you are interested, it has all the Bs, including B12. And it is, sorry about that. A patient came in the office. We have a little dog in here. She's not very, she's little, but she's a big dog in a little body. That's Luna. She's actually in some of my videos if you were interested in looking. But this is a metabolism booster. This is a energy booster as well. So if you are on the pens, if you are on anything that's not compounded with any B vitamins, this is something that you should try, because what this does is it actually increases your energy and increase your metabolism. But you need to DM me or go to my bio and you can find this in there and just contact me and then we can get this to you. So if this is absolutely amazing, you start out with 1 a day for about a week and then you go to 2 a day, or you can just stay on 1 a day. But you will definitely feel the energy from it, and it is absolutely amazing. So if you're interested, you can please reach out. Yes, as Jose say, I love my gummies. Everything I have is in a gummy. My weight has affected my mobility and arthritis. Looking forward to WL on Z. So yes, and if you are having trouble with your Z, you are getting any of them, you can please reach out to us. I do have, and actually, my video was removed, but I do have the Medicare guidelines, the new guidelines. I tried to do a video, but it was not allowed. So if you are interested, DM me and I can give you those guidelines and I can try and help you with that. But yes, I can definitely help you with that. And they're very strict, and it's strictly Medicare. And if you don't, I would imagine if you have a Medicare supplemental, I don't know if they're going to follow the same guidelines or not, but you guys are funny. So somebody asked, does it affect the kidneys? Actually, no, it helps the kidneys. So there is research, and actually a lot of the nephrologists are putting patients on it for the kidney benefits. So they're actually seeing improvement in kidney numbers, as well as the liver, fatty liver, and liver cirrhosis. So they're seeing a lot of improvement in those. I'm on the O lettuce and absolutely loving it. Week 6, and I lost 14. Oh, that's fantastic. On 0.25. That's wonderful. Losing at a much slower pace now. Yeah. So should I increase? So losing at a slow pace, should I increase? Women should lose 1 to 3 a week, guys, 3 to 5 when your BMI is above 30. So losing slow is good. Okay. Actually, it is a really, really, really good thing to lose slow. So, what happens when you lose slow? You keep it off. So, no, Lily, that's a kind of a loaded question. You can, but you don't need to. I tell people, as long as you don't have the food, noise, and cravings, stay down, stay slow, stay low. There's no reason in going up. If you're doing good at that lower dose, just stay there. There's not really any reason to go up. That's what I tell people. is just stay low. It's fine. And as long as you aren't having that food noise and the craving and you are still eating okay, you're getting your protein, you're getting your hydration, you feel fantastic, just stay low. Yes, that's the ultimate goal is go low, stay low, go slow. That's fine. All right, everybody. I am Angela. I am a nurse practitioner. I have a clinic in Medina, Ohio. I actually can prescribe in all 50 states. I have a wonderful physician that I work with. And if you would please feel it in your heart to share this right now, that would be fantastic. And please follow me. I also need you to hit your screen so that you can send those little hearts up. That would be wonderful. And thank you very much. Okay, let's progress on. All right. Let's see what other questions we have here. All right. Thank you everybody for following me. Okay, let's see. I got lost. Give me a second here. All right. We do offer telehealth. I just saw somebody said something about that. So we do offer telehealth in all 50 states. Started GLP last week. Did you say it helps with inflammation? Yes. We actually have had quite a bit of patients say that it does help with inflammation, and they have really good results with that as well, because I'm really hoping to feel some relief from my arthritis in my knees. The other thing is, as you have the L and you get the W off, you notice improvement with your knees as well, which is a good bonus also. I'm trying to decide which telehealth company to use that is safe and not too expensive. So we offer telehealth in all 50 states, and we have an all-inclusive program. Our price includes absolutely everything. We don't have membership fees, contracts. We don't have any of that. So our price is one flat rate, and it covers absolutely everything. We are running a promotional this month that if people in households join, then it's one, and you order at the same time, then we're giving you a discount for shipping. We have a referral bonus that if you refer somebody, you get $30 off. And so ours, currently our S is $289 for the month. And then our T, the first 2 months are, keep getting $389 for T for the first 2 doses, and then it goes up to $439, and then that's for everything else. And then we do pre-filled syringes, so you don't have any guessing work at all, and it comes with B12 and B6. Can I do cardio and light weights in the gym if I'm not meeting my calorie goals? I already answered that. TikTok doesn't like cussing, Strap. I feel like MJ's great. I love all of them, to be honest with you. And I highly recommend starting out with S because of cost. They are very similar medications. I like medications that have been out longer, because if a medication has been out the longest, it's been there. It's done that. And we have great loss with S. And they both have very similar symptoms. They both are very similar in L. They both, if you've looked at the research, have 14 to 17% L. That's very similar. They both can give you the exact same results. They both have the exact same side effects. I actually find myself more nauseous on T than I do S, and I've done both of them twice. So I think that I would know because I've done both of them twice, and I've done them both over the past 4.5 years. So I've had most of my L on S. And so I really do feel that S is very, very effective. So why pay more money just because the marketing company of T, MJ, and is just better and has more marketing dollars to spend on it and tells you that it's a much better product, it's a newer product. Typically, everybody thinks the newer product is better because it's newer, better, and greater, but it's not. S is just as fine. So why spend more money on it when it's fine? Okay. So beach walking mama, I had to come off of W because of the risk of for eye stroke. So obviously your provider and you decided that you were at a higher risk of that. So I wonder, Beach Walking Mama, do you have diabetes and do you have diabetic retinopathy? Because honestly, diabetic retinopathy is the higher risk of eye issues. So that's one of my questions. Because, and then why did they feel that you were at risk for eye stroke? Because that's a very rare thing, to be honest with you. So Mrs. Patches. So I also do believe, and I have to be careful because I might get in trouble here. I do believe sometimes that name brand is less effective than compound. And I've actually seen this in my practice with patients. They will leave me, and I'm compound only, have been for 4.5 years. But say the insurance now will cover them and they'll go switch to name brand because the insurance will cover it. And now all of a sudden insurance says, nope, not going to cover it anymore. Then they'll come back to me. And that has happened a few times. And what happens is when they come back, they'll have better L, and that's normal. And I've had that happen quite a few times. So I agree with you, Mrs. Patches. So yes. Has anyone actually gone blind on a GLP? There are some lawsuits out there. I don't know if any of the lawsuits have been successful. The only people that have actually had issues are people with diabetic retinopathy, Miss Beach Walking Mama. Other than that, I've never heard of any other issues. Where do you get ZenWise women's probiotics? In my store, and there is another place, but I am not allowed to mention it on here. In my store, and I will show it at the end of this actually, I could show it now. I wait until the end or close to the end of me being on here. So give me a second and I will have these up here so you can see them. And then you guys will have the opportunity to look at them on my store. While I'm doing this, please go to, please follow me. Please share this live as well if you would not mind. And I thank all of you for being on here today. Oh, and I just saw why you said that because it is not in my store. They are sold out on TikTok. I see that. So I'm going to show this one. So this one is a digestive enzyme as well. So you can find this one on here as well. All right, now I just lost where I was. All right, so this is a digestive. Thank you, Crystal, for writing that on there. You are correct because I am not allowed to say that. Mariah, Crystal just wrote down where you can because I'm not allowed to say that. Started on GLP, feel like a lot of increased anxiety. Kins, is it tea or one of the tea products? Because that is actually a real thing. Because it is actually with tea, or not typically tea, but Z, as they actually have that on their commercial. And what I would do is recommend talking to your provider about that because that is actually a real thing. And you specifically with tea or any of the tea products, especially the name brand. So what I would recommend is switching to S or talking to your provider and they can help you figure that out. What products are we talking about? We're talking about GLP, but I did just specifically put a product down in the bottom that I pinned. So we are going to talk about some of the products here. I feel like MJ is less effective than T. That is, we just talked about that. What do you all do for constipation? Okay, constipation is a real problem. First of all, we need to prevent it. Constipation is best to prevent. But, and I will pin this in a second. Actually, let me pin it now because I think I get in trouble if I don't have that product up when I'm talking about it. So let me pin it. Hold on. This is one of my number one go-tos for bowels. So first of all, you do fiber. And I love gummies. So I'm going to talk about a bunch of gummies right now. So first of all, you do fiber. You start out 1 a day for a couple of days, 2 a day for a couple of days, 3 every day. Then you do your probiotic, and I'll show that here in a second. Then you do this every single night. You do 1 gummy every single night. This has 10 magnesiums in it. So a lot of people will say, oh, I'll just take magnesium citrate. Oh, I'll take Mago 7. Why? When this has 10. This has all 10 of your magnesiums. Plus it has L-theanine and zinc, which is good. Zinc is good for your thyroid. L-theanine and zinc are good for your immunity. So it's going to help prevent any kind of colds or, flus or anything like that. Plus it has vitamin D in it. But this is an amazing product. It helps with your muscles. It helps with all of those other issues that you might have. But this is good to take at bedtime. It's going to help your bowels. Okay? So this is really, really, really important for you to take. The other one that I highly recommend for your bowels is, oh, I didn't add it in here. 1 second. Let me add it. One second here. This is my other go-to for the ladies. Okay? This is Leafair. This is a gummy as well. This is a pre and probiotic, but any woman over the age of about 30 should be taking this. These are absolutely a must for women. It's a pre and a probiotic. It doesn't have the digestive enzymes in it, but what it does have is slippery elm. So it keeps your girly parts moist. And it helps with, it's just a go-to. This is one of the things that I wish every woman would take, because as we age, things go dry. And this is going to keep you from going dry. This is going to help your bowels. This is a GLP must. Okay. So I absolutely wish everybody would do this. Fabulous Fit. Late joining. What was the magnesium name? It is, oh, I lost it there. It is VEV. Magnesium 14 in 1, or I'm sorry. Yeah, 14 in 1, sorry. So, both of these are absolute musts when you're on a GLP. Now, if you get diarrhea, you don't want this one. You might want to miss it that day, that night, hold off of it for a day or two. But the Leafair is a absolute must for sure. And thank you, Fabulous Fit, for being over there. I do appreciate you being on here. I do for sure. But this one, these are amazing products and everybody should be on them. Absolutely a GLP must. Okay. I had painful skin after Zepbound. 7.5 was ballistic. Okay. That is a not very common, but with Zepbound, sorry about that. With Zepbound name brand, it's usually because of the preservatives in it. So what I would do is talk to your provider and talk to them. And if it was at the site, I highly recommend don't use the alcohol prep pads. I don't know what it is about those alcohol prep pads, but a lot of times the alcohol prep pads cause irritation to the skin. I don't know what it is, why it is. Don't use them. And every nurse that is on here is going to cringe and say, oh my God, Angela, you are crazy. Don't tell these people not to use the alcohol prep pads. They cause irritation. And I don't know why, but they do. It is so crazy. It is better just use soap and water or just don't use anything at all. But try that first. Then if it still has a problem, then talk to your provider and let them know that it is actually the pen or something else. Because those pens, they have a lot of preservatives in them, and they can the irritation of the preservative is probably what's doing it. It's crazy. Definitely. Why when I was off, I gained. Okay. When you go off of these, you need to wean off, for one thing, because the noise is going to come back insane. It comes back and you are just like craving like crazy. So what you have to do is you have to wean off. The second thing is, if you don't change the way that you eat and change your lifestyle, and you continue to go back to the way that you ate, you eat simple carbs, you eat fried fatty foods, you go back, it's just like a gastric bypass. If a person that has a gastric bypass goes back to eating the way that they did before they had the gastric bypass, what happens? They regain. You can't do that. So you have to make sure that you don't go back to your old ways, because you will regain, and the hip pain will come back. Everything will come back. So what you have to do is make sure, one, you wean off. Two, you don't go back to your old ways, because it's inevitable. It's going to happen. So I don't know how to help people, because I think the message is getting out there that you have to wean off, but people, first of all, insurance stops paying for it. So you have no options. Second of all, it's hard to wean off when you have the pens. Third, a lot of providers don't help you. They don't tell you this. So you just kind of like don't have the support, so you don't know. So it's just aggravating to me as a nurse practitioner. And I just don't know how to get that message out there. And I can't tell everybody. I had a much larger account and I was able to help people. So I just need people to follow me. I need people to get my information out there, because if people were helping me get my information out there, then I could get my account bigger like it was, and it'd be all good again. So I just need you guys to help me share, help me get the information back out there. But it is so important that everybody understands, you have to wean off slow, because if you don't, it's just inevitable. It's going to happen. But that's why it came back, and it came back with a vengeance. Okay. All right. Please share my live. Please follow me. I really do appreciate it. I have about 24 minutes left. Did you see they gained some W during that time? It's brutal, people. It is brutal. Thank you, everybody, for following me. I really, really do appreciate it. Okay. I gotta see. Wait here. I got lost. Okay, we have one question down here. I'm Angela. I am a nurse practitioner. I am in Medina, Ohio. So if you have any questions, please please DM me. Please put your question down here, and I am more than happy to answer those questions. I am a type 1 diabetic, on O for over 6 months, barely lost any. Okay, so when you are a type 1 or a type 2, there are things that you have to be very mindful of, because when you're type 1, type 2, it is almost impossible. You have to trust the process, is what I tell my diabetics that come in. So before I left traditional practice, I did a lot of diabetic teaching, to be honest with you. So it was one of my things that I was really, really, really good about. And I really, really did a lot of diabetic teaching. And the Mule and Goat, she said that she takes this one, and she says it really worked, and this one too. They really, really do work. I take them every day religiously, and they really, really do work, and they're fantastic. Okay, so now I have up on screen, and I don't have them for the other thing that's up, but perfect amino. And this goes along with the type 1 diabetics as well, diabetes in general, diabetics in general. Okay, diabetics. This is so important, but it's so difficult. So when you're a diabetic, protein, as long as you don't have kidney issues, because when you have kidney issues, you have to talk to your nephrologist to specifically work with this one, because diabetes is difficult. Fabulous Fit. Hang on one second and we'll talk about hormone replacement, okay? Because that is also something very important as well. And this can go to Super Hubert as well, because hormones is also important for everybody. But diabetes is one of those things that really makes losing hard. So when you're a diabetic, protein is like one of the most important things, but also blood sugar control is the other very important thing. So if your blood sugar is not perfect and your A1C, it's not even so much the A1C, but the A1C is not controlled, then the blood sugar is not controlled. So what I mean by that is, if your blood sugar is not at the absolute, I would say like 100 to 120, fasting. So when a person is diabetic, actually everybody, we have two different types of insulin. We have a basal insulin and we have an eating insulin. Okay. Our basal insulin is 24-hour insulin. Then we have a basal or an eating insulin. So when we eat, our insulin goes up and it grabs our food and it brings it down. So anytime we eat a sugar, what we do is we spike our insulin and we spike our sugar. So if we don't have protein, we drop out. That's when we have a low blood sugar. So what we have to do is we eat that protein so it balances out our insulin and it comes down together nice and even. So when we are diabetic, what happens is our blood sugar goes up. We don't have enough insulin, so our blood sugar stays up and it never comes down. So what we need to do is we have to have that protein so that it can help balance out, and so we don't drop out, and then we don't have that spike of our blood sugar, and so our insulin can work a little bit better. So what we have to do is, as a diabetic, we have to make sure we have more protein than carbs when we eat. So what you need to do is, as a diabetic, make sure every time anything goes in your mouth, there's protein with it, and more protein than carb. So when we eat, everybody, this is anybody on a GLP, anytime you eat, you need the protein. Okay. So what you're doing as a diabetic, you're trying to balance out that protein so that the protein is the priority and the carb is not. So what you want to do is everybody, because when you're on a GLP, you're trying to pretend that you're kind of like a diabetic. So what you're doing is you're eating protein. We want our complex carbs because that's energy. So if you're naturally getting it from the earth, so if it's from the earth, it's a complex carb. Complex carbs naturally from the earth. Simple carb processed white by man. We don't want it. It's processed by man. So that is going to spike our insulin, spike our blood sugar, and we don't want it. That's why it drops out. We feel gross. We feel tired. We feel nauseous. We don't want it. So what we need to do is protein. Okay. That's what's really, really, really important. So what the protein does is it's balancing out our bodies. So when you're taking in that protein, you're balancing out your insulin and you don't drop and bottom out. So when you're a diabetic, it becomes very, 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 very important that you're getting that protein. So what I tell my diabetics is you have to get that balance, but your loss is going to be a lot slower than anybody that's not diabetic. So I'm really, really, really good at helping my diabetics finally get that loss. it takes a minute. It really, really does. You aren't going to have that normal loss like a person, normal, not diabetic person does. So, when I say guys over a 30 BMI that have 3 to 5, or women over a 30 BMI that have a 1 to 3 a week, you're probably going to be on that lower end. It can still happen, but you have to get that protein. So it's really, I tell my diabet, you really, really, really have to trust the process, because if you don't, you might not have it. So this is really, really, really important. So what I really, DM me, because it's super important to understand that, because if you don't understand that, you're not going to have that L. And it's really hard for diabetics to trust the process, because it's so frustrating. And actually, for everybody, it's so frustrating. And this is important for that stall as well, because when you hit that stall, what do you want to do? You want to give up. Don't give up. Don't ever give up, people, because that is what I'm here for. That is what my team is here for. Because you know what? How many times do you think I wanted to give up? How many times do you think I said, forget it, I'm done, I'm not doing this no more? I've been there. I understand. So I get it. And that's what's so important. And that's why I love what I do. And yes, I told you I can prescribe, but it's not important. I'm just here to, really educate and teach, guys. And that's what I'm here for. So thank you, Super Huber, for saying that. Guys, hit that screen, because that's what I'm here for. All right. So we got about 15 more minutes. Yes, Wendy, you can stay on these forever. And actually, the research is saying stay on these forever, because the second you go off, guess what? The cardio benefits that you get from being on them, the second you stop, goes away. So cardiologists, nephrologists are putting people on them for the benefits of being on them. And we don't want people to go off of them now, because they're getting the great benefits of being on them. So it's super important for people to be on them. They're putting, Alzheimer's patients on them now, because it's helping with the mental capacity and all of that stuff with it too. So they're really showing some amazing benefits. So that's what's really cool about all of them. So thank you for hanging with me when I went on that tangent of, the diabetics and all of that. I should actually get on the board. You guys can't see it, but I have a board back here of where to jab. So this is, I did a video on this yesterday, and I can't get this video to go, and I don't know why. But if you feel the love, go on my page. And I actually thought it was a pretty cool video, especially at the end when I kind of put my goofy head in there. But this was my new where to jab video. Yes, if you guys find it in your heart to make any of my videos go, I would really, really appreciate it. But I really like to do funny videos. So this was a collagen that I found, and I really, really thought it's pretty good. It's a gummy. I love gummies. Jose said it. I'm the gummy queen. Okay. So somebody said, I've tried Z and W. It doesn't matter what dose it is. It makes me feel terrible. Thoughts on why? Okay. So when you are starting any of these, you really, really, really need to make sure that you're starting out on them from the very beginning. Watch my pinned video for one thing, because my pinned video really helps you understand what you need to know to start them out properly. Because, and I'm going to run through this really, really quick. Okay. So I don't know if you guys can, well, actually it's on my pinned video. So you can tag it or save it or however, whatever that is. I am not the techiest person. Oh, and I got to talk about HRT. Okay, let me do that first, and then I'm going to run through my free consultation. Okay, HRT. So Fabulous Fit And HRT is not, it is not like that horribly expensive. We try to make everything not really that expensive. I try to keep everything as cost effective as I possibly can. So there's some multiple different ways to do it. But what you do is we do labs, and it's 150 across the country. And you go locally and you get them done. It's $1,000 panel, and it's $150. And I tell you what you need. We look at your thyroid. We do 4 tests on your thyroid. I tell you how to optimize everything. We look at your B12, vitamin D, 4 hormone tests. We look at your ferritin levels, your kidney, liver, electrolytes. We make sure you're not anemic, all of that stuff. Okay. So then what we do is you may need estradiol. About 50% of women do. Not everybody needs estradiol. I have had only one woman that has not needed testosterone. Most women need testosterone. Almost every guy needs testosterone. That's crazy, right? But then not everybody needs progesterone. So there's 3 hormones that you may or may not need. Okay, so we talk about that. Then we figure out what you do or don't need. Like I said, I can't prescribe in every state. I think it's 8 states that I can get the hormones in. Then we figure out what type you want to do, and then we go from there. Then, so it is amazing. But what we do is based off of symptoms and lab tests. It is all you individually based. So we figure out what each individual person needs. Then we help you. It's insane. Then we help you figure it out. So that is how the hormones are. Pricing is a little bit different for everybody, just because of what you need. But it's not that bad. And like for women, if you do pellets, it's like $350 for every 3 months. So it's not horrible, but it's so life-changing. So it's really, really amazing. Okay, so I'm going to do the free consultation, and I'm going to do it really fast because, but it's also in a pinned video. So I think it's amazing, and I think everybody should experience it. Okay. GLPs work 3 ways. They shut down the hunger I'm craving. You need to listen to it for the first month. And because if you've never stopped and learned to listen to it, it's really, really important. Then the second thing is it slows down your digestion from the top to the bottom. We'll talk about the bottom here in a second. But the first is you need to learn to listen to your stomach. You need to eat to I feel food in my stomach, not to full, because you'll be very uncomfortable. The third way is insulin resistance, was just as amazing. Then bowels. First of all, if you have had issues with nausea prior to starting, then you need Zofran. That is something that your provider should give you if you have had issues with nausea. The second thing is bowels. You need to prevent constipation, okay? Constipation is huge. If you've had issues with constipation prior to, you need to make sure that you prevent it from this very beginning before you even get the meds. So you start fiber, 1 a day for a couple of days, 2 a day for a couple of days, 3 every day. Then you start your probiotic. It could be in this, or it can be in Zenwise, Zenwise, and you get that starting immediately. Then the other one is you start your magnesium, VEV, VEV, magnesium 14-in-1. Okay, very, very important. So you have to get those bowels moving every day. If they aren't moving every day, take Miralax. Then what you need to do is no simple carbs. That is anything processed by man. If it's white, processed by man, do not eat it. It will give you indigestion, belching, nausea, and it will make you sick. Get it in your brain. It's going to make you sick. Don't even try it. Don't eat it. Stay away from them. That is what makes us look like this. Okay? We don't want to look like that anymore. That's why we're going on these things. Okay, then what you do want to eat, 25% of your diet should be naturally from the earth, complex carbs. Those are going to make you feel good. They're going to give you your energy. They are going to make you just that you need them. So you want to stay away from fruits. Fruits are high glycemic. Fruits are, your body can't tell sugar from sugar. Is it a simple carb or is it a fruit? So you don't really want to eat a lot of those unless that's a day that you're going to be more active. It was a day you're going to be in the gym. So you can have those fruits on those days. Then your protein. Protein is essential. 75% of what you eat is your protein. So you want to make sure women are getting 100 to 120 grams a day, guys 120 to 150. You want to get technical, get a scale that tells you your muscle. Every pound of muscle is 1 gram of protein. Then what you want to do is, if you have any questions, reach out, DM, I can help you. But it is essential that you get your protein. We don't talk about calories until you hit the stall. Once you hit that stall, then we will talk about your calories. That is what I tell everybody when they first start these. That is your free consultation. So DM me if you have any questions. I can definitely help you. All right. Any questions? All right. I am Angela. I am a nurse practitioner. I have a clinic in Medina, Ohio, and I am here for you. All right. Steph, good morning. What can you do about I get UTI so often? I have tried so many things. Okay. So I need to bring this bottle in. Go. Dang it, I can't say the name. Somebody else wrote the name a little bit ago, but it's D-MANNOSE, I think is how you spell it. Mayonnaise. I always want to say mayonnaise, but it's mayonnaise, I think is how you say it. But it is a natural flora for your bladder that can help you. The other thing is you can drink cranberry juice. Do not do cranberry pills. They do not work. The other thing is if you DM me, and actually I'm thinking about getting it for myself because I have been getting them more frequently than I had in the past. And there is a supplement that I can get, and I have not bought it yet. And I've kind of been going back and forth because I didn't want to get it for just myself. But if there are some women that are interested, I would be willing to buy it and we could try it together and I'd give you a discount. So if you are interested, DM me and I could do that. I just haven't bought it because I didn't want to just do it for myself. But I have heard it works really, really well. It's through BioT, and that's who I do my hormone replacement for here in my clinic. And it is supposed to be really, really good for the bladder. And I just haven't done it for myself. Sounds like pregnancy. With the nausea. So how do I start the process and how do we give our shot? Oh, shoot. Shouldn't have said that word. That's fine. But is that the process? So if you are interested in working with us, you can go to my bio and get the information, or you can just DM and I can help you with that. Is this your only channel or do you have multiple? Fabulous Fit. You are on... actually, I can, on this one, I can give you, because you are on something else. So I can give you my actual info, Fabulous Fit. Because I'm on something else. I have all platforms. But that is how you get a hold of me. I don't know how to type on the other one. I can't. So I'm actually live on multiple things right now. So I have to be careful because another one is very sensitive. And I get in trouble on the other one a lot. All right. So if you're interested in us and you want to become a part of our family, because you are actually a family member, you can go to my bio. You can DM me. My info is in my bio. You go up to here and you click on, on the one. The screens are flipped on different spots, but you go here and then you can get my information. The other one, I put the information in the chat. But yeah, you can definitely reach out and we would love to have you a part of our family. Just DM. All right, we talked about the UTI thing. Actually, Anybody ever on the on here, have you guys noticed that you get more UTIs? I'm just curious if that's a thing. Actually, I'm gonna do a video on that. UTIs. I'm gonna do a GLP family question. I do a lot of those. I've been doing a lot of the here, and actually I'm gonna put this on here. Oops. 1 second. I'm typing on another area. So hold, please, everyone. While I'm doing this, can you guys please follow me? Please follow me. I am almost done. I have 1 minute left. So please follow me. And please go to my other, it's this television. And I would love to have you on there. It is Recrea_health. And I would love to. Okay. Yes, you need to drink enough water to be going every hour. I don't know if anybody's ever told you that, but that should be your goal. And you should be moving your bowels every day on GLPs. I am not joking. That is your goal. So you should be moving your bowels every day, and you should be urinating every hour. Yes, really, every hour. And your urine should be a very pale to clear yellow. Unless you're on vitamin Bs, then it'll be a hot yellow. It'll be a glowing yellow because of the bees, but it should be very clear. I am not joking. Yes, you should be definitely moving those bowels every single day. Oh, I forgot to put this one up here. This is the clear protein, you guys. It's a clear protein powder. It's a whey isolate. And I said whey earlier, so I lied. It's a whey isolate. I don't know if you guys know the difference between proteins. So let me break this down for you. So whey is, I can't drink whey. A lot of people can. It's the least expensive of the proteins. A lot of people can drink it. But if you all of a sudden have really nasty gas and bloating, then it's the whey. Now, some people cannot drink whey, but they can drink whey isolate. So whey isolate is a very refined whey, and it's still okay. So a lot of people can drink the whey isolate and they're fine. I can drink it like 2 times a week and I'm okay. Then there is soy, there's vegan, there's, you have your milk products like Fairlife and Nuri are a very well refined milk product, but it doesn't need to be refrigerated. I drink Herbalife, doesn't mess with my stomach at all. It's a powder. I mix my own. There are so many different types of protein out there. There's the Perfect Amino that I showed you, which is actually a pill. You take, you eat, you swallow 5 of those. It's like having 29 grams of protein of whey. So they are vegan, gluten-free. Herbalife has multiple different versions of their protein as well. So what are you looking for? Luna's bag. There's all sorts of different protein types out there. But a lot of people like the Seek. That's different flavors. Comes in a tub, comes in individual packets. So there's all certain different types of the Seek out there. And people like the Clear, which is really cool also. Then so there's a lot of different versions of the protein out there. So you just try it and you find what you like. That's what's simple about it. But I like the Clears when your stomach is angry. So, or, sometimes you just don't want the milk stuff. You want something that's not heavy, and you need something that's not heavy, especially when it's hot outside. That just really makes a difference too. When it's not hot outside and you just want something that's just simple on your stomach. So thank you, everybody. Follow me, please, at U Television. Recrea_health. I need to build that. And I really, really appreciate everybody following me on here. Thank you for all of the hearts and love. Thank you for all of the shares. Thank you, thank you, thank you. And I love you guys. You are fantastic. Mad Lit Dad. That's a great name. And I really, really do appreciate you guys today. So please add all of these products to your cart. You can go back and, look at them later. And please look at things and let me know if you have any questions. You could always DM me. And if you are interested in anything at all, just let me know. And, you can go to my bio anytime. And I am always here for you. We are always available to answer any questions that you have. And, TikTok is a very safe place to buy stuff. I buy stuff off in here all the time. So definitely any questions that you might have, I'm here for you. You guys have a wonderful day. And I appreciate you hanging out with me this morning. And have fun at work. All right. Talk to you later. Bye.